Let's go live to Perth and bring in the Minister for the NDIS, Bill Shorten. After news this week, the Minister announced about a blowout in the budget for the NDIS. Bill Shorten, thanks for your time. You announced this $8.8 billion over 4 years blowout. Now, in July, you announced that price limits for all NDIS supports will increase by 9%. And all current NDIS plan budgets will be automatically increased to account for those changes. Could that have had any effect on this blowout?
No. First of all, what we announced wasn't 9% for everything. The award, which covers the disability carers, the sort of rank and file of the care support industry, had got an increase in their award, and we were implementing that change. That was about 5.5%. There was also some costs to COVID, which we were compensating the participants for. In addition, there was some one-off increases to assist registered providers improve their services. The problem with this valuation that was presented to me is that in March, Treasurer Frydenberg said one thing, and then within 6 months it turns out that that budget wasn't worth the paper it was written on in terms of NDIS costings, and now I've got figures that in 4 years' time there'll be an extra $8.5 billion. The real challenge here is the long-term neglect of the NDIS by the previous government. But what I also announced, along with the change in forecasts for 4 years' time, was that we're putting in the best thinkers in the world of disability and economics, and we're reviewing the NDIS a year early so that we can make the reforms which rebuild trust in the scheme, which start focusing on investing in people rather than the cost-cutting, but also make sure that taxpayers are getting value for money and we can curb the trajectory of the growth costs.
Well, Mr Shorten, how many people are currently serviced by the NDIS and how much has that increased by since September?
Since September? Well, there's about 550,000 people who make claims on the NDIS who are served.
So last September, should I say?
10% from 12 months ago.
Yes.
Or do you mean last month? Which
no, I mean 12 months ago.
Andrew? Sorry, you've lost me. Oh, okay.
September 2021.
I couldn't tell you the exact. Okay, I couldn't tell you exactly off the top of my head, but it is some. Well,
would you be surprised to know it's 14% more participants?
Well, I don't know if that's exactly right. What I do know is that if we want to break down these 550,000 people, 10% of the participants attract about 50% of the funds. So when you say there's been an increase, what we're seeing is an increase in children seeking support for early intervention. They don't tend to be the most, the participants who require the greatest resourcing.
Could you tell me what the average annualised payment, the average is to each participant at the moment?
It's about $55,000.
And so,
but I tell you what, Andrew, while you're asking about the average cost, it's really important that we have an informed discussion about the NDIS. And by that what I mean is that not every participant is the same. So averaging is it's a tool, but it's not necessarily the most useful tool. I think the reasons, what Australians want to know is, one, is the scheme doing what it's meant to do, and two, what are the cost drivers? Now, with the cost drivers, we've been in office for 4 months, but I have to... Oh, OK.
Sorry, Mr Shorten, I think the first question that... The first question you posed there is a really important one because, I mean, you were involved in setting it up. Wasn't this scheme originally set up for the most profoundly disabled? Hasn't it wandered off that a little bit?
No, it was set up for the most profoundly and severely impaired Australians. I think when the reports were initially done, they underestimated the amount of unmet need in the scheme. In other words, there are a whole lot of people and families scraping by who were not getting any support at all. Now they are getting support. I think what's driving the growth in the scheme and the costs in the scheme is much more complicated than just whether or not a child's been diagnosed with autism. I think there's, like, it's a basket of challenges. And I don't think the previous government really, other than trying to make it harder to get on the scheme, really rolled up their sleeves. So there are issues within the scheme, in my opinion. Very quickly, one, I think there is some crooked behaviour going on and fraudsters. I also think there's inefficiency and waste. I also get concerned that there is insufficient checking of invoices. I also get concerned that there's some overcharging in some services. But beyond that, I also think there's a challenge in terms of making sure that we have got skilled people working in the sector, so there's a workforce challenge which increases and exacerbated problems. But beyond the challenges within the scheme, I think there's another conversation to be had that the NDIS, when we proposed setting it up, was never intended to be the only lifeboat in the ocean. You know, what I mean by that metaphor is that we didn't want it to be the only thing going for services for people with disability in Australia. So for people who are much more mildly, live with much more milder disabilities, we need to make sure that the states and other government departments aren't retreating from their obligations, washing their hands of everything and just saying that's an NDIS matter.
Well, just on lifeboats, it's been put to me that the NDIS can be used to help someone sail a boat or go and have sex with a prostitute. Now, I'm sure these are the exception, not the rule, but isn't there some tightening you can do in these areas?
Well, first of all, you're talking about what I think are a very small number of matters where there's controversy, but I do think that we need to tighten up what invoices are paid for. What are the services that are paid for? No question. And you talk to, you know, the hundreds of thousands of people on the scheme and they would nod their head in agreement with that proposition. What amazes me, though, is that I don't think enough work's been done on the back office of the scheme. You know, the back door. At the front door, there was a big debate, just make it harder for people with legitimate disabilities to get on the scheme, and that was where it seemed to me the previous thinking really was focused on. Whereas when I've come in, I've been surprised and frankly staggered at the lack of scrutiny about invoices that come in the back door. But that is not to say that people with disability are having a lend of the system. What I get worried about is wherever there's government money, and you've seen this too, you've covered it as a journalist, from the private sector TAFE schemes to long daycare to the financial services sector, where the government mandates money, what happens is between the taxpayer and the person who's meant to get the money, you get a lot of rent seeking. So I do think that has to be a focus of our reform and review.
All right, Mr. Shorten, just a final question here. Is it true to say, or isn't it true to say, the states have their costs capped in relation to their commitment to this, but there is no cap on the federal spending? Isn't that a big problem in this whole thing? You need to cap the thing, not just have it open-ended.
Well, what we need to do is make sure the states are doing their fair share. I think you go to one of the big issues. As I said, there's internal cost drivers, there's external challenges that there are not enough services outside the scheme. But you're right, the state-federal relationship in the scheme is not what I think it should be. When it started, it was a 50-50 style arrangement. But in 2017, the previous government, you know who, negotiated arrangements with the states where now the federal government pays 63% of the scheme and the state governments pay 37%. So I think that has to be visited too. I think this whole conversation in the last few minutes has shown there's a lot of complexity. What people with disability and taxpayers won't get from me is the argument there's a simple solution. What they will get from the review we've announced, from appointing Kurt Fearnley, the chair, who are overhauling the leadership of the NDIA, for getting people who are stuck in hospital, who shouldn't be in hospital, who are disabled, through tackling the legacy court cases, which is tying up people and time, is that we're prepared to put the NDIS on the to-do list, not the too-hard list.
Mr. Shorten, thanks so much for your time.
Lovely for the catch-up. See ya.